Welcome to Vitality Link Dispatch, where healthcare innovation meets practical implementation. I'm your host, and today we're exploring a groundbreaking blueprint that could transform healthcare as we know it. Our focus is Dr. Mostafa Bouattane's evidence-based transformation framework, a systematic approach to solving healthcare's most persistent challenge, fragmentation. Dr. Bouattane, MD, MBA, has created what I can only describe as the most comprehensive roadmap for healthcare AI transformation I've encountered. Let's start with the sobering reality. 35% of U.S. Medicare beneficiaries see 5 or more different physicians. Only 1/3 of family doctors receive feedback from specialists after referrals. This fragmentation drives an extra $1,085 per patient per year in waste. That's billions annually across our healthcare system. But here's the human cost. Documentation alone consumes 13.5 hours of every clinician's work week. In Canada, 18.5 million clinician hours are wasted annually on unnecessary paperwork. These aren't just statistics. They represent burned-out doctors, overwhelmed nurses, and patients not getting the attention they deserve. Dr. Bouattane identifies this as the healthcare fragmentation cycle, where administrative overload leads to clinician burnout, which degrades care quality, which increases costs and inefficiency, creating more administrative burden. It's a vicious circle that explains why so many healthcare reforms have failed. Dr. Bouattane's blueprint centers on 5 key technologies working together as an integrated system. First, agentic AI, autonomous software entities that can triage referrals, verify insurance, and book appointments while communicating in natural language. These aren't rigid rule followers. They make contextual decisions and learn from experience. Second, ambient AI scribes, secure microphones with large language models that listen to patient-doctor conversations and automatically draft clinical notes in real time. Dr. Bouattane's research shows this can cut documentation time by 50 to 90%, reclaiming 3 to 7 hours per week for physicians. Third, process mining creates digital X-rays of patient journeys by analyzing electronic health record audit trails. European hospitals using process mining report 50% shorter inpatient stays after implementing guided redesigns. Fourth, the Kaizen PM loop combines frontline improvement workshops with process mining dashboards to create sustainable, data-driven improvements owned by staff themselves. Finally, closed-loop systems automatically detect problems and trigger responses without human intervention, like detecting patient anxiety through wearables and scheduling mental health support calls. Dr. Bouattane's transformation spans 24 months across 5 phases. Phase 1 involves a comprehensive readiness assessment across human, process, and technology dimensions, achieving at least a 70% readiness index before proceeding. Phase 2 focuses on gap closure, targeting a 25% reduction in workflow cycle time variation through lean methodology, shared performance metrics, and infrastructure improvements. Phase 3 deploys AI agents strategically, ambient AI scribes targeting 70% documentation reduction, radiology continuity agents doubling follow-up rates, specialty referral navigators increasing appropriate referrals by 3.5 times, and hospital discharge coordination agents reducing preventable readmissions by 25%. Phase 4 creates AI agent swarms, working together with real-time process mining dashboards, achieving 20% reduction in operating room delays and 15% decrease in patient wait times. Phase 5 proves the business case with ROI monitoring and regional ecosystem expansion, targeting greater than 15% reduction in acute care spending system-wide. What makes this blueprint compelling is that every projection is grounded in real-world evidence. Dr. Bouattane projects 50 to 90% reductions in clinician documentation time, supported by studies in JAMA Network Open and an eJAM Catalyst. Fragmentation-related cost savings of at least $1,000 per patient are backed by multi-hospital analyses. Patient throughput improvements showing 50% shorter stays come from Dutch hospital process mining studies. Most importantly for our burned-out workforce, he projects 20 to 30% reductions in after-hours EHR time, with patient satisfaction showing double-digit improvements and care coordination seeing 3.5 times improvement in appropriate referrals. The financial projections are equally impressive. Positive ROI within 14 to 18 months with $3.20 return per dollar invested. These aren't promises. They're evidence-based projections from organizations already implementing similar systems. Dr. Bouattane emphasizes 3 critical success factors. First, visible executive sponsorship linked to cross-departmental metrics with regular obstacle removal and clear accountability. Second, developing a data-driven culture with process mining as the foundation for all improvement decisions. Third, clinical engagement through physician and nurse leadership in AI governance, frontline staff involvement in design, and clear communication that AI augments rather than replaces clinical judgment. Dr. Bouattane has given healthcare leaders something rare: a roadmap that is simultaneously visionary and practical, ambitious and achievable, technology-forward and human-centered. His systematic approach addresses human, process, and technology dimensions simultaneously, creating compounding improvements where each success builds momentum for broader transformation. The statistics he presents: 35% of Medicare patients seeing 5 or more physicians, only 1/3 of doctors getting specialist feedback, $1,085 per patient wasted on fragmentation. These represent human suffering we have the tools to address. Before we close, I want to highlight Dr. Bouattane's recently published book, Healthcare's AI Revolution, a practical guide for clinicians, leaders, and patients, available now on Amazon. This comprehensive guide perfectly complements the blueprint we've discussed today, providing the broader context and practical insights needed to navigate the AI revolution in healthcare. Whether you're a clinician trying to understand how AI will impact your practice, a healthcare leader planning digital transformation, or a patient curious about the future of care, this book bridges the gap between cutting-edge AI capabilities and real-world implementation. It's worth reading to truly grasp the essence of this transformation blueprint. The question isn't whether this transformation is possible. Dr. Bouattane's evidence makes clear that it is. The question is whether healthcare leaders will have the courage to begin the journey. For organizations ready to break the cycle of fragmentation, administrative overload, and clinician burnout, this blueprint offers not just hope, but a clear roadmap. The technology exists. The evidence is compelling. The path is clear. The only question remaining is, when will you begin? That's all for today's Vitality Link Dispatch. Thank you for joining us, and remember, the future of healthcare is being written right now.